Hi, I'm Leeanna and I work at Proactive Pelvic Health Center. I'm a pelvic health physiotherapist and I wanted to talk to you today about some lifestyle tips for bladder and pelvic floor health. So one of the things that happens is clients will come in and they'll have complaints of urinary urgency, urinary frequency symptoms. And so what I like to touch on is some lifestyle strategies. So for example, I spend a bit of time educating my clients on bladder irritants. So the top 3 bladder irritants that are known are alcohol, caffeine, and smoking. So with consumption of this, that acts like an irritant to the bladder lining. The bladder doesn't like it and it will be more inclined to contract and want to get rid of your urine, so it can contribute to urge and frequency. There's other bladder irritants that exist that are often discussed in more detail with your physiotherapist, but what's really helpful is keeping a bladder diary. So we use some bladder diary and we review that to get a better sense of trends with you in your lifestyle that could be influencing or irritating your bladder specifically. Another thought in terms of bladder irritants is hydration. Hydrate, hydrate, hydrate. Majority of my clients are very underhydrated. So I encourage my clients at first to start to even look at the color of their urine when they pee. If it's really, really dark and quite yellow, then that's sometimes an indication that they are underhydrating. They are not consuming enough water. And the more concentrated that urine is, the more that acts like a bladder irritant to the bladder lining, thus contributing to symptoms of urge and frequency. I also spend a lot of time ensuring that my clients are fully emptying their bladder when they're on the toilet. So pelvic health physiotherapists talk about strategies to connect you to your pelvic floor as you're peeing to make sure those muscles are doing what they should be doing. But some things that can further help this is to make sure that you always sit and you're fully supported. So never hovering over the toilet seat, as that tends to inhibit the muscles from fully relaxing and therefore can inhibit you fully emptying. Other little tips are be very present in that moment and be very patient. Some of my clients will push to pee to just get it done because they're halfway out the door and it's taking too long. That can be very detrimental to the process of actual voiding. Voiding is very passive. It should involve full relaxation of all of the pelvic muscles. So it should never be an active push process. Finally, I also talk to my clients or suggest that they're aware of not overholding their bladder. So some of my clients are really proud of themselves. They have a camel bladder. They can hold forever and ever and ever. And in essence, it's quite normal to urinate every 2 to 4 hours. And so you want to make sure that if you're finding that you're really going much longer stretches, that can lead to problems in terms of the bladder wall being overstretched, which thus weakens the bladder wall and thus can contribute to weakness of the bladder contractions when you're trying to empty. So we want to make sure when that happens over time, it can cause what we say is some residual urine being retained. And when the residual urine is retained, that can cause further urgency sensations or frequency, urinary frequency, or even the potential for more urinary tract infections. So those are some of the tips that I talk to my clients about, and if you're finding that any of this really resonates with you in any way, I highly recommend that you consider booking at Proactive Pelvic Health Center to try to address and get some strategies in place.